Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister, welcome. Thanks again for facilitating us.
Well, thank you once again for having me in this program.
Yes, sir. Let's begin with yesterday. It was the first day of school, and we know we mentioned it yesterday. You've been collaborating with the Ministry of Education. Could you give us any feedback from yesterday?
I think so far it has gone very well. I think a lot of students were anxious to return to school. And of course, given the new guidelines and protocols, that probably had heightened a bit of their anxiety. But I think everything went well. The teachers and the education system they were well prepared. So they had the appropriate distancing in the classroom. And while it would take a little bit of adjusting for everybody, I think they have done very well for the first day.
All right. Are you able to tell us at this time anything on President's College? We read that there were a little difference in figures in the media.
So we are trying to test all the students who are going to be in the dorm. I think there are about 159 students who would be resident in the dorms there at President's College. We were able to complete maybe about 90-something persons, test 90-something. The rest would be tested this morning. And of those persons who were tested, 8 of them were positive. They have since been isolated, and they're going to be observed for the 10-day period, and if they remain asymptomatic, they can rejoin the other students in the dormitory. So far, none of them have really presented with any signs or symptoms. It's just that when you do the PCR tests, we have been able to detect these asymptomatic patients.
All right. You had indicated to us yesterday that all the derm schools, the testing will be carried out as well.
Yes, and the RHOs in the different regions have been collaborating with the education officials, and they have a plan of how those testings are going to be done. For some of the hinterland regions, not all the students have come into the dorms yet. They're still coming in, and so we want to get everybody in, and then we'll be able to do proper testing in some of these facilities. But the idea, yes, is to make sure that we test everybody, and if we find any positives, we would isolate them to make sure that there are no commingling and other problems with other students.
Right. I know that over the last week when we spoke, you mentioned that Ocean View, the contractors rather, were nearing completion. I know you visited yesterday. Can you give us an update?
So the sections dealing where we had mild cases, well, those sections are operable and they have been working. What we are focusing our attention right now on is to ensure that we have the ICU up and running. The main obstacle there was we did not have the lines for medical gas. And so those lines have now been installed. Oxygen has now been put in place. We've had suction and other things that are necessary there. So all that we have now installed. And they're now doing some final touches to the floor. And once that is completed, I suspect by the end of this week, we would be able to start the ICU facilities at Ocean View. We'll be having 25 beds in the immediate ICU area. And we have another area where we have operating theater and some other spaces for recovery and so forth. We will be able to house a number of other patients in those areas as well. The intake area where people would have to come in when they're sick, we're still working on that section, and that would require a little bit more time for completion. There are other little projects that we have on the site itself that we will have to continue working on. We still have to finish the reservoir for water, but in the meantime, the facility do have adequate supply of water because we have black tanks, but they have to be refilled on a regular basis. We're now creating a bigger reservoir, so when that is completed, the hospital would have more or less an independent source of water. We also had some challenges with the sewage. We've been able to rectify that. And there are some other amenities that we are also in the process of fixing. But we can consider that we are getting the Ocean View facility in phases. So as we finish one phase, we are putting it to use while we continue to do some of the other things.
And in terms of staffing?
Staffing, we have deployed some of the staff from the Georgetown Hospital, so both nursing and um, you know doc- doctors would be from Georgetown Hospital. The idea is that most of the COVID 19 patients from Georgetown Hospital would be over at the Ocean View facility. And as we transfer the responsibility over to Ocean View, then those doctors who have been operating at Georgetown Hospital and the nurses would be transferred over to that facility.
Just for a matter of clarity, is the Ocean View facility an extension of GPHC?
They're under the management of the GPHC. So the same doctors who are working at GPHC would now be in control of what happens at Ocean View.
Okay. Can we ask you at this time for an update on Region 1 and St. Cuthbert Mission in Region 4?
Region 1, again, the main area of focus in Region 1 has been Quibana. And as I said before, we expect those cases to come down. We have a team there that has been monitoring. And by the end of the week, we expect that we'll have far less case than we have right now. They're still active because they're in that period when we are monitoring. And so by the end of the week, they should complete that 10-day period, and therefore we can discharge most of them. Nobody so far has displayed any serious signs or symptoms. Most people have been mild. But as the protocol dictates, we have to observe them and make sure that they're okay. And again, if anybody develop any sign or symptoms, we would be able to treat those persons appropriately. The surrounding areas, again, we have spoken to a lot of the residents in those areas, and we continue to monitor them. We have not seen any spike in cases there. On the contrary, we know where the active cases are, and they have all been isolated. So it's a work in progress. We keep monitoring and observing, and Quibana remains in lockdown. In terms of St. Cuthbert's Mission, we have had 97 cases there so far. We have done about 130 more tests, and we expect among those that we'll see some amount of positive patients. We have been collaborating with the Tushao of the village, and we are going to continue to have that presence and monitor and, of course, do more testing. We have had two cases yesterday that had some respiratory challenges, and those patients have been removed and brought to the hospital. So this is an ongoing exercise, and again, we will strengthen our medical presence in St. Cuthbert's Mission. We'll add another doctor who would be based there for the next 2 to 3 weeks, and we'll add some additional medical staff there.
Okay. Before we go, two things. I wanted you to comment on the fact that there is renewed optimism for a new vaccine. But before we do that, could you just remind us a little bit about the U.S. officials that we're expected here to conduct regional training?
Well, we are collaborating with officials from the U.S. Embassy, and they're bringing in a team of doctors who would assist us with training of personnel locally. They would be going out to each of the regional hospitals, working with the staff there, both doctors and nurses. And we'll be looking a lot at how to use ventilators, how to intubate patients. So these are skills that our doctors, most of them should have these skills, but this would be like a refresher course to them. And because COVID, a lot of these patients in the severe and critical period would require ventilation. This course is a timely one. So we expect that this refresher would help our peripheral doctors, especially, to be more aware of some of the newer techniques that are being used in some of the metropolitan areas of the United States. And you know, they have had a lot of experience dealing with COVID patients, so they're, you know, telling us some of the practices, and hopefully, if we do have patients that need those services, then we'll know exactly what to do.
Right. I just before we touch on the vaccine, last month when the Surinamese delegation was here, you met with the health minister. I know that one of the things that you discussed was training as well. I'm not sure if you have met since. Are you able to tell us anything about that?
Well, we are going to collaborate with Suriname, and we have a working group that has been established between the two ministries. That working group is scheduled to meet shortly, and among the things that we will be discussing includes training. The other things that we'll be looking at is to have protocols to allow for safe reopening of our borders. So we'll have to see what protocols they have. They would have to check what protocols we have and see how we can synchronize them to make sure that both countries are comfortable with the protocols that would be in place. So this is a work in progress. We haven't completed the arrangements as yet, but we're working to ensure maybe in another week or two that we'll have all those protocols in place.
Okay, thank you, sir. So the vaccine, let me see if I get the word correctly. Is it Pfizer? And then there's another BioNTech. What is basically your thoughts on it?
Well, there are a number of vaccines that are in the phase 3 trial. Pfizer is one of those vaccines where there were lots of hope that it would, you know, produce good safety and efficacy. The results that Pfizer has released have shown that after the second dose, this is a vaccine where it's 2 doses. So you get dose number 1, and then 28 days after, you get the second dose. So after the second dose, they were able to determine that it was 90% efficacious, which is a good number. And it shows that, you know, if people use the vaccine, well, then maybe it would be able to prevent the disease. However, this is now at the phase 3 trial, and the company would have to meet certain requirements of the FDA. And once they meet those requirements, they would be issued with an emergency authorization to be able to go ahead to manufacture. So there's a lot of optimism, and if, as the company has said, that it's efficacious and it's at 90%, then we can look forward to having a very effective vaccine. I understand that they have also said that by the end of the year they might be able to produce about 51 million doses, and that's a welcome addition to what is being done. And then by next year, there will be much more doses available. So again, it's a good thing. There are other vaccines also that are right now being developed. Guyana has been working with COVAX, which is a global group that is supported by the WHO, Gavi, and CEPI. And through that mechanism, they have been monitoring 9 candidate vaccines. And again, those 9 have been in phase 3 trials, and as those results become known, the COVAX mechanism would make some determination on which they would financed to be manufactured. And they're hoping to have 2 billion doses of those vaccines available by next year, of which Guyana would benefit from that mechanism. So we are going to get vaccines, and we're optimistic that they're going to work and work very well.
Okay. Well, Minister Anthony, thank you so much for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.